Welcome to SATO Career 2.0 online nursing channel. This is AIIMS NORCET preparation moral test 5.0 answer key. In this video, we are going to discuss the answers for those 100 questions which we have asked in the moral test 5.0 on Sunday. Now, let us go inside the video and let us see the answer for all those 100 questions. Before that, if you have not yet subscribed to our channel, please subscribe now and click the bell icon to get the latest notification about all our new videos. If you need to join our moral test series, the WhatsApp number is given in the comment box. You can send a request to that WhatsApp number. We will add you in the WhatsApp group for the moral test for the AIIMS NORCET 2020. Now let's see the first question here. Now let us discuss the 100 questions which we have asked in the model test 5.0, and here we are going to see the response rate of our AIIMS aspirants also in percentage. The first question, which among the following is the most common cause of hyperaldosteronism? Option A, a pituitary adenoma. Option B, a deficient potassium intake. Option C, excessive sodium intake. Option D, an adrenal adenoma. The condition which causing hyperaldosteronism is option D, an adrenal adenoma. So for this question, 216 participants out of 310 have given the right answer. Option D is right. Move on to question number 2. When caring for a male client with diabetes insipidus, a nurse expects to administer option A 10% dextrose, B vasopressor, C regular insulin, option D furosemide Lasix. The right answer option B vasopressor. More than 55% of the participants have given the right answer for this question. Now let's see the question number 3. What response should a nurse offer to a client who asks why he is having vagotomy to treat his ulcer? Option A, to repair a hole in the stomach. Option B, to prevent the stomach to produce acid. Option C, to remove potentially malignant lesions on the stomach. Option D, to reduce the ability of the stomach to produce acid. So the vagotomy is performed for the right reason, to reduce the ability of the stomach to produce acid. So out of 310 participants, 179 had given the right answer. The right answer they have given for the vagotomy reduces the ability of the stomach to produce acid. Now let's see the question number 4. A client with ulcerative colitis is following orders for bed rest with bathroom privileges. When evaluating the effectiveness of this level of activity, the nurse should determine if the client has option A, conserved energy, B, reduced intestinal peristalsis, option C, minimize stress, option D, obtained needed rest. So a client with ulcerative colitis who is on bed rest with bathroom privileges. So when you evaluating the nursing intervention, what you can observe? We can observe for reduced intestinal peristalsis. So for this question, 154 participants had given the right answer out of 310. Reduced intestinal peristalsis can be noted, which determine the effectiveness of nursing intervention for the client with ulcerative colitis. Now let's see the question number 5. A client who has a history of Crohn's disease is admitted to the hospital with fever, diarrhea, cramping, abdominal pain, and weight loss. The nurse should monitor the client for option A hypokalemia, B hypercalcemia, option C hyperalbuminemia, option D thrombocytopenia. So when a client who is suffering from Crohn's disease, who is frequently having the fever, diarrhea, abdominal cramping pain and weight loss, the nurse should monitor for hypokalemia. For this question, with the very good response, 80.6 percentage, that is 250 contestants have given the right answer here. Hypokalemia is the right answer. Question number 6. What is the major difference between Hodgkin's lymphoma and non-Hodgkin's lymphoma? Option A, non-Hodgkin's lymphoma is treated only with radiation therapy. Option B, non-Hodgkin's lymphoma can present in multiple organs. Option C, Hodgkin's lymphoma is considered potentially curable. Option D, Hodgkin's lymphoma occurs only in young adults. The right answer is option B. Non-Hodgkin's lymphoma can present in multiple organs. So out of 310 aspirants, 125 had given the right answer. Non-Hodgkin's lymphoma can present only in multiple organs. Now let's see the question number 7. In severely anemic patient, you expect to find option A, cyanosis and pulmonary edema, B, cardiomegaly and pulmonary fibrosis, option C, dyspnea and tachycardia, option D, ventricular dysarrhythmias and VC. So in severely anemic patient, we find the client is having dyspnea and he or she is prone to develop tachycardia. So 221 respondents have given the right answer here. That is 71.3 percentage of the participants who taken the test have given the right answer. Dyspnea and tachycardia is noticed in a severely anemic client. Now let's see the next question. Question number 8. Which findings allow you to identify the patient's anemia as folic acid deficiency rather than cobalamin deficiency? Option A, lack of neuromuscular symptoms. Option B, changing nail shape. Option C, red tongue. Option D, loss of appetite. So, yeah, anemia is a folic acid deficiency or it is a cobalamin deficiency. How we can find out? In folic acid deficiency, there is no neuromuscular symptoms present. So 101 respondents had given the right answer as lack of neuromuscular symptoms. Now move on to question number 9. When reviewing a pathological laboratory values after splenectomy, you would expect to find option A, RBC abnormalities, option B, leukemia, option C, decreased hemoglobin, option D, increased platelet count. So here majority of them had given the answer as RBC abnormality, 150 participants, but the right answer is increased platelet count. So the splenectomy followed by the splenectomy procedure, there will be increase in the peripheral RBC and platelet, and that storage will be affected. As a result of that, the platelet count tends to increase more. So 50 participants had given the right answer as increased platelet count. Question number 10. Which individual is at high risk for cobalamin vitamin B12 deficiency anemia? Option A, a 54 man with a history of irritable bowel disease, and ulcerative colitis. Option B, a 47-year-old man who had a gastrectomy, that is removal of the stomach. Option C, a 15-year-old girl who is a vegetarian. Option D, a 20-year-old woman who complains of heavy menstrual period. So the right answer here, a 47-year-old man who had a gastrectomy is prone to develop a cobalamin deficiency, vitamin B12 deficiency. So 148 respondents had given the right answer for question number 10. Now move on to question number 11. Question number 11. A client with a renal failure is prescribed a low potassium diet. Which food choice would be the best for this client? Option A, 1 cup of rice. B, 1 cup of beef broth. Option C, 1 baked potato with the skin. Option C, option D, half cup of raisins. So for the client who needs low potassium diet, the best choice would be 1 cup of rice. So for this question, 164 participants had given the right answer. 1 cup of rice is a low potassium diet. Question number 12. Assuming that all have achieved normal cognitive emotional development, which of the following children is at greater risk for accidental poisoning? Option A, 1-year-old child. B, 4-year-old child. C, 8-year-old child. Option D, 12-year-old child. So the child who is at risk for accidental poisoning, the age group is 4-year-old child. So 193 participants had given the right answer as 4-year-old child. Now let's see the question number 13. Which of the following is an expected finding in the assessment of a client with bulimia nervosa? Option A, muscle wasting. B, extreme weight loss. Option C, presence of lanugo over body. Option D, erosion of the tooth enamel. So in a client with bulimia nervosa, the most expected finding would be option D, erosion of tooth enamel. So 142 participants had given the right answer, that is 45.8% response were right for the question number 13. Clinical feature of mumps are option A, fever, cough and enlargement of submandibular glands. Option B, fever with enlargement of thyroid glands. Option C, fever, tenderness and enlargement of both parotid glands. Option D, fever, tenderness and enlargement of tonsils. So in the mumps, the clinical feature which is characterized by fever, tenderness and enlargement of both parotid glands. So 248 respondents have chosen this option. Tremendous response rate for this question, 80%. Question number 16. Now let's see the question number 16. Vector which transmits Kala-Azar is option A, female phlebotomine sandflies. Option B, male phlebotomine sandflies. Option C, triatomine bugs. Option D, Aedes species mosquito. So Kala-Azar is transmitted by the vector female phlebotomine sandflies. So 226 respondents have chosen the right answer for this question. The Kala-Azar is transmitted through female phlebotomine sandflies. Question number 17. After discharge from the hospital, the patient develops an intense fear of being alone. This is known as option A compulsion, B obsession, C phobia, and D somatization. So intense fear of being alone, that comes under phobia. So agoraphobia, fear of being open spaces. So the right answer is phobia. 237 respondents out of 310 had given the right answer. Now let's see the question number 18. The nurse is reviewing radiographic images of a patient with schizophrenia. The nurse should be alert which of the following brain changes that is noticed. Option A, altered sensorium. Option B, decreased brain tissue. Option C, decreased third ventricular size. Option D, increased blood flow. The right answer is option B, decreased brain tissue. So in schizophrenia, the brain tissue size decreases. Option B, 59 respondents had answered correctly for this question. So the third ventricular size will not be decreased, the fourth ventricle size will be decreased. That's why the 116 respondents had chosen this option. There will be decrease in the fourth ventricle, not the third ventricle here. Question number 19. Sensorium changes we cannot find with radiographic investigation. Now question number 19. Which of the following classes of drug is the most likely to be fatal if a patient overdose? Option A, benzodiazepine. B, tricyclic antidepressants. Option C, antihistamines. Option D, typical antipsychotics. The drug among these four which can cause a fatal overdose effect. Option B, tricyclic antidepressants. 65 members have chosen the right answer, and majority of the people have chosen benzodiazepine. Benzodiazepine is the second fatal side effect producing psychotropic agent. First one is antidepressant, the tricyclic hypertensive crisis that may occur here. Question number 20. Question number 20. During assessment, the patient tells the nurse that he can no longer work because he spends most of his day aligning and realigning all the items in his apartment. The nurse identifies this behavior as indicative of option A, acute stress disorder, B, generalized anxiety disorder, option C, panic disorder, option D, obsessive compulsive disorder. So changing the things and rechanging the things is coming under OCD. So majority 223 respondents had given the right answer for this question, obsessive compulsive disorder. Now let's see the question number 21. Now let's see the question number 21. The question is, a nurse is gathering health history information from a patient. The patient says she takes Baspirone but does not know why. The nurse should educate about the drug, what effect it is going to cause in the treatment. Option A, schizophrenia. B, bipolar disorder. Option C, suicidal ideation. Option D, in the treatment of anxiety. Buspirone is an anti-anxiety agent. So our 164 participants have chosen the right answer. Buspirone is used to treat anxiety disorders. Question number 22. A patient is engaging in a therapy that encourages the patient to act out emotional experiences from their past. What is the name of this therapy? Option A, gestalt therapy. Option B, dynamic psychotherapy. Option D, psychodrama reality therapy. Option D, psychoanalytic therapy. So, in which therapy the patient is asked to experience all the emotional experiences of the past? The right answer is the psychodrama reality therapy. So, for this question, 92 participants have given the right answer. Majority of them have chosen psychoanalytic therapy as the right answer, but psychodrama psychodrama is the right answer here. Question number 23. The nurse is caring for a 40-year-old woman. The nurse is caring for a 40-year-old woman complaining of the sudden onset of numbness and tingling in her legs and difficulty in standing. She has been informed that there is no physical basis for her symptoms. Which of the following deposits her present complaints? Option A, conversion disorder. B, malingering. Option C, illness anxiety disorder. Option D, restless leg syndrome. So there is a tingling sensation in her legs and difficulty in standing. Numbness is also present, but no physical basis is found which is related to these symptoms. This indicates the client is having conversion disorder. The right answer, this conversion disorder was chosen by 121 samples. Restless leg syndrome is mostly found during the sleep time only. During sleep time, they won't keep the legs in rest. The legs will be kicking the partner who is sleeping with them. So the right answer is conversion disorder. Now let's see the question number 24. A patient is admitted to the psychiatric unit after a suicide attempt. The nurse plans to write a suicide contract to promote compliance and build a trusting relationship with the patient. The contract should: option A, be written with the patient. Option B, be written by the physician. Option C, be written by the nurse and the patient. Option D, be written by the social worker. So the suicide contract between the patient and nurse, that is the right answer. So 133 participants had given the right answer here. Suicide contractor writing by the patient only, but it is the deal between the every contract will be between two persons. One is patient, another one will be the nurse. Question number 25. The nurse is caring for a elderly resident with influenza. The nurse monitors closely for which common complication of influenza. Option A, pneumonia. B, sepsis. Option C, respiratory failure. Option D, Guillain-Barre syndrome. So in influenza, the elderly women can get the chance to develop pneumonia more commonly than other things like sepsis, respiratory failure, and Guillain-Barre syndrome. So 191 respondents have given the right answer here. Now let's see the question number 26. A nurse on a medical surgical unit is preparing to admit a client who has active tuberculosis. Which of the following rooms are appropriate for the nurse to admit the client? Option A negative pressure room. Option B, a positive pressure room with another non-surgical client. Option B, an ICU. Option D, a room close to the nurse's station. This tuberculosis, we need to maintain the droplet precaution. For that, we need to go for a negative pressure room. Option A is right. 245 respondents has given the right answer out of 310 here. Now let's see the question number 27. A nurse is a nurse is caring for a client who is dying on cancer and has prescription for an opioid pain medication as needed. The nurse concerned that administering a dose of the pain medication might hasten the client's death. Which of the following ethical principles should the nurse use to support the decision not to administer the medication? Option A, veracity. B, utilitarianism. Option C, fidelity. Option D, non-maleficence. So the ethical principle which the nurse should follow in this condition is non-maleficence. That is, non-maleficence means does not producing any harm. So our participants 169 have given the right answer as non-maleficence. Question number 28. In question number 28, the nurse is teaching the client with hypertension about the low salt diet. The nurse tells the client that which item is lowest in sodium content. Option A, antacids. Option B, laxative. Option C, toothpaste. Option D, demineralized water. The low sodium content among these four is option D, demineralized water. The water from which the minerals have been taken out. Demineralized water. So 216 participants have given the right answer for question number 28. Now let's see the question number 29. Jaundice appears within first 24 to 48 hours after birth is called as option A, physical jaundice. Option B, physiological jaundice. Option C, pathological jaundice. Option D, psychological jaundice. Which type of jaundice occurs in first 24 to 48 hours? That is option C, pathological jaundice. 133 respondents had given the right answer here. Now let's see the question number 30. SEDEX solution will be changed in how many days? Option A, 7 days. B, 12 days. C, 14 days. Option D, 21 days. SEDEX solution will be changed in 14 days is the right answer. 185 respondents had given the right answer for this question. Move on to question number 31. A postpartum nurse is providing instruction to the mother of a newborn infant with hyperbilirubinemia who is being breastfed. The nurse provides which most appropriate instruction to the mother? Option A, switch to bottle feeding the baby for 2 weeks. Option B, stop the breastfeeding and switch to bottle feeding permanently. Option C, feed the newborn infant less frequently. Option D, continue to breastfeed every 2 to 4 hours. So the right appropriate instruction given to the mother, postpartum mother regarding the breastfeeding will be option D, continue the breastfeeding every 2 to 4 hours. 265, that is 85.5 percentage of our respondents had given the right answer here. Now let's see the question number 32. A neonate has been diagnosed with caput succedaneum. Which statement is correct about this condition? Option A, caput succedaneum. Regarding caput succedaneum, which statement is correct here? Option A, it usually resolves in 3 to 4 weeks. Option B, it doesn't cross the cranial suture line. Option C, it involves swelling of the tissue over the presenting part of the presenting head. Option C, it is a collection of blood between the skull and the periosteum. So the caput succedaneum is involving the swelling of tissues over the presenting part of the presenting head. So this statement is right and it is given by 160 respondents. Now let's see the question number 33. Which condition or treatment best ensures lung maturity in an infant? Option A, meconium in the amniotic fluid. Option B, lecithin to sphingomyelin ratio more than 2:1. Option C, absence of phosphatidylglycerol in amniotic fluid. Option D, glucocorticoid treatment just before delivery. So which condition or treatment best ensures lung maturity in an infant? The parameter is the lecithin to sphingomyelin ratio should be more than 2:1. So 205 participants had choose this option. This is right here. Question number 34. A woman delivers 3,250 gram neonate at 42 weeks gestation. That is post-term baby. Which physical finding is expected during an examination? If this neonate, option A, leathery, cracked and wrinkled skin. Option B, absence of sole creases. Option D, breast bud of 1 to 2 millimeter in diameter. Option D, abundant lanugo. So in a post-term infant, the assessment will reveal leathery, crackled and wrinkled skin. 164 participants had chosen this answer. That is right. Leathery, cracked and wrinkled skin is seen in the 42-week old, that is the infant, the post-term infant. Now, question number 36. During fetal life, maximum growth is caused by option A, insulin, B, growth hormone, option C, thyroxine, option D, cortisol. So, in the fetal life, the maximum growth is caused by option A, insulin, 61 percentage. That is only 19.7 percentage of the respondents had given the right answer for this question. But once the birth of the child occurs, growth hormone is responsible for the growth and development of a child. But in the fetal life, insulin does this role. Question number 36. Which of the following is the living ligature of the uterus? Option A, inner layer of myometrium. B, endometrium. Option C, middle layer of myometrium. Option D, perimetrium. The living ligature of the uterus is option C, middle layer of myometrium. So 112 participants had given the right answer. Middle layer of myometrium is the right here. That is the living ligature of the uterus. Now question number 37. What is the pressure inside the uterus during second stage of labor? Option A, 100 to 120 millimeter of mercury. Option B, 200 to 220 millimeter of mercury. Option C, 300 to 400 millimeter of mercury. Option D, 25 millimeter of mercury. So in the second stage of labor, the pressure inside the uterus is 100 to 120 millimeter of mercury. Option A is right. 104 respondents have given the right answer out of 310 respondents who took this exam. Question number 38. The parameters assessed prior to induction of labors or all except. Option A, fetal gestation age. B, fetal weight estimation. Option D, fetal part palpable. Option D, ensure fetal presentation and type. So which of the following is not assessed prior to induction of labor? All these things are done except option C, fetal part palpable. The right answer was chosen by 24.2% of the respondents here. Question number 39. A patient with TB tuberculosis who is on isoniazid therapy also administered. Option A, pyridoxine. B, riboflavin. Option C, nicotinic acid. Option D, thiamine. So which of the following drug is given to a TB client along with isoniazid? The right answer was chosen by 227 respondents. Pyridoxine is right here. Now let's see the question number 40. So which nerve injury leads to foot drop? Option A, common peroneal nerve. B, tibial nerve. Option C, sciatic nerve. Option D, obturator nerve. So the common nerve which causing the foot drop is common peroneal nerve. So 204 respondents had given this answer as right. This is the right answer here. Now let us see the question number 51. A nurse is preparing to assess the respiration of a newborn infant just admitted to the newborn nursery. The nurse performs the procedure and determines that the respiratory rate is normal if which of the following is noted. Option A, respiratory rate of 20 breaths per minute. Option B, a respiratory rate of 40 breaths per minute. Option C, respiratory rate of 90 breaths per minute. Option D, a respiratory rate of 100 breaths per minute. So for a newborn infant, the respiratory rate which is normal is 40 breaths per minute. Our respondents 255 have selected option B, which is right here. Now let's see the question number 52. During a routine prenatal visit, a client in her second trimester of pregnancy reports having a cough pain when she walks. The nurse suspects superficial thrombophlebitis and checks for which sign associated with this condition. Option A, severe chills. B, Chadwick sign. Option C, Brudinsky sign. Option D, palpable thrombus that feels hard. So the right answer is option D. The palpable thrombus which feels hard is right, and it was chosen by 232 respondents here. All other symptoms are not related to the cough pain. Now let's see the question number 53. A nurse is caring for a child with Reye syndrome. The nurse monitors for signs of which major problems associated with this syndrome. Option A, protein in the urine. B, symptoms of hyperglycemia. Option C, increased intracranial pressure. Option D, a history of staphylococcus infection. The Reye syndrome is associated with the following syndrome. The right answer is increased intracranial pressure. Out of 310 respondents, 138 respondents have given this answer. Question number 54. A nurse admits a client with suspected diagnosis of bulimia nervosa. When performing the admission assessment, the nurse elicits data knowing that the client with bulimia. Option A, binge eats then purges. Option B, is accepting of body size. Option C, overeats for the enjoyment of eating food. Option D, overeats in response to losing the control of diet. So here in bulimia nervosa, the client will eat, that is binge eating behavior is noticed, followed by that they involve in inducing vomiting, that is purging behavior. 216 respondents out of 310 have chosen this answer as right. Now let's see the question number 55. A client with extremity burn injury has undergone fasciotomy to treat compartment syndrome of the leg. The nurse prepares to provide which type of wound care to the fasciotomy site? Option A, dry sterile dressings. B, hydrocolloid dressings. Option C, wet sterile saline dressings. Option D, 1/2 strength betadine dressings. So in a client who undergone fasciotomy followed by severe burn injury, in treating the compartment syndrome of the leg, the nurse should provide wet sterile saline dressing to treat the wound. Out of 310 participants, 113 participants have given this answer. Question number 56. The nurse assesses a peripheral intravenous dressing and notes that it is damp and the tape is loose. The best nursing action is to option A, stop the infusion immediately. Option B, apply a sterile occlusive dressings. Option C, ensure tight IV tubing connection. Option D, remove the IV and insert a new IV. So when the nurse notices that intravenous dressing is damp, when the tap is loose, then the nurse priority action is to check for the tubing. If it is light, the nurse should make sure it is tight. So ensure tight IV tubing connection is the right answer. But here majority of the participants have gone for the first option, stop the infusion immediately, but that is not a right answer for this question. 68 participants have given the answer correctly for question number 56. Now let's see the question number 57. The nurse assists a physician with the removal of chest tube. During the removal of the chest tube, the nurse instructs the client to perform which of the following? Option A, breathe in deeply. Option B, breathe normally. Option C, breathe out forcefully. Option D, exhale and bear down. So while removing chest tube, the best action the patient should do is do the Valsalva maneuver, that is exhale and breathe down. So 160 participants have given the right answer here. Question number 58. The nurse assesses the water seal chamber of a closed the nurse assesses a water seal chamber of a closed chest drainage system and notes the fluctuation in the chamber. The nurse determines that this finding indicates that option A, the tubing is kinked. Option B, air leak is present. Option C, the lung has re-expanded. Option C, the system is functioning as expected. So for this question, the majority of the participants, 189, have given the right answer. The system is functioning as expected. So when there is in a water seal chamber, which is closed in a chest drainage system, when there is fluctuation in the chamber, that indicates that the system is functioning properly. Option D is right. Question number 59. A child is admitted to the hospital with a diagnosis of rheumatic fever. The nurse reviews the blood laboratory findings, knowing that which of the following will confirm the likelihood of this disorder. Option A, increase leukocyte count. Option B, decrease HB count. Option D, increase anti-streptolysin O titer. Option D, decrease ESR. So in rheumatic fever, the diagnostic confirmatory test is test for ASO titer. So for this question, 240 respondents have given the answer correctly. Now let's see the 60th question. A 5-year-old child is admitted to the hospital for heart surgery to repair the tetralogy of palate. The nurse reviews the child's record and notes that the child have clubbed fingers. The nurse understands the clubbing is most likely caused by option A, tissue hypoxia, option B, chronic hypertension, option C, delayed physical growth, option D, destruction of bone marrow. So the clubbing of fingers in tetralogy of Fallot is due to option A, tissue hypoxia. So 257 respondents have given the answer correctly in the test. Question number 61. A client has been admitted to the hospital with a diagnosis of acute glomerulonephritis. During history taking, the nurse should first ask the client about a recent history of option A, bleeding ulcer, option B, deep vein thrombosis, option C, myocardial infarction, option D, streptococcal infection. So for this question, the right answer is streptococcal infection. 256 respondents have given the answer correctly. So when a client is diagnosed with acute glomerulonephritis, during history taking, the nurse asks the client about the recent history of any infection. That infection would be due to streptococcal infection. Streptococcal infection mostly causes this glomerulonephritis. Question number 62. A client has been admitted to the emergency department with chest pain. Serum enzyme levels are drawn and the results indicate an elevated serum creatinine kinase CKMB isoenzyme, troponin T and troponin. The nurse concludes that these results are compatible with option A, stable angina, B, unstable angina, option C, prinzimetal angina, option D, new onset myocardial infarction. So in the new onset myocardial infarction, the serum creatine kinase C level, the CKMB level, isoenzyme level, troponin T and the troponin level are found to be increased. So here majority of the participants, 227, that is 73.2% participants had given the right answer. Move on to question number 63. A nurse is caring for a client receiving bolus feeding via nasogastric tube. Which position does the nurse use to administer the feeding? Option A, supine. Option B, semi-Fowler's position. Option C, Trendelenburg position. Option D, lateral recumbent position. So for a client who is receiving the feeding via bolus through nasogastric tube, the position given is semi-Fowler's position. 296, majority 95.5 percentage people had given the answer correctly. Question number 64. A nurse is planning care for a hallucinating and a delusional client who has been rescued from a suicidal attempt. The nurse plans to option A, check the client's location every 15 minutes. Option B, begin suicide precautions with 30 minutes checks. Option C. Initiate one-to-one suicide precaution immediately. Option D. Ask the client to report suicidal thoughts immediately. So in a client who have hallucination and delusional behavior and who is rescued from the suicidal attempt recently, the nurse should plan for one-to-one suicidal prevention precaution has to be started immediately. So for this question, 113 participants have given the right answer. So for such client, there should be a continuous supervision on one-to-one basis. Question number 65. A nurse is developing a plan of care for a client receiving anticoagulant agents. The nurse identified which potential problem is the priority for this client. Option A, injury; B, infection; C, fatigue; option D, dehydration. So this anticoagulant agent will be given to the client who is having any type of injuries only. So option A is right. 253 participants had given this answer correctly. Question number 66. A client was admitted to the nursing unit with a closed head injury 6 hours ago. During the initial assessment, the nurse finds that client has vomited. It and the client is confused and complains of dizziness and headache. Based on this data, which of the following is the most important nursing action? Option A, notify the physician. Option B, administer antiemetic. Option C, restrain the client from surroundings. Option D, change the client's gown and bed linen. So when the client is vomiting, when the client is having closed head injury, and when the client is confused and having the complaints of dizziness and headache, the nurse's priority response is to immediately notify the physician. So 267 respondents had answered correctly to this question. Now question number 67. The nurse is caring for a client who has undergone transprenadal surgery for a pituitary adenoma. In the post-operative period, the nurse teaches the client to: option A, cough and deep breathe hourly; option B, remove the nasal packing after 48 hours; option C, report frequent swallowing or post-nasal drip; option D, take acetaminophen for severe headache. So during post-operative period followed by the transprenadal surgery, the nurse teaches the client to observe for any frequent swallowing or any postnatal drip. So this answer is correct and it was answered correctly by 208 participants. Question number 68. Acetyl salicylic acid is prescribed for a client with coronary artery disease before percutaneous transluminal coronary angioplasty. The nurse administers the medication understanding that it is prescribed to: option A, relieve post-procedural pain; option B, prevent the thrombus formation; option C, prevent post-procedure hyperthermia; option C, prevent inflammation of the puncture site. So followed by the coronary artery disease. So the nurse is going for percutaneous transluminal coronary angioplasty. Before that, the nurse is administering the medicine aspirin, acetyl salicylic acid. So the nurse understands the action of this medication is to prevent any thrombus formation. So the right answer was given by 221 participants. Now let's see the question number 69. A nurse develops a post-operative plan of care for a client undergoing arthroscopy. The nurse should include which priority action in the plan? Option A, monitor intake and output. B, assess the tissue at the surgical site. Option C, monitor the area for any numbness or tingling sensation. Option D, assess for complete blood count results. So the nurse who is undergoing arthroscopy, the priority action for the nurse is to check for any numbness or tingling sensation in the client lower extremities. So 193 participants had given the right answer to question number 69. Now question number 70, nurse in the coronary care unit is caring for a client admitted with acute myocardial infarction. The nurse should monitor for which of the most common complication of acute myocardial infarction. Option A, cardiogenic shock. B, cardiac dysarrhythmias. Option C, congenital heart failure. Option D, recurrent myocardial infarction. So in a client who is admitted in coronary care unit, the followed by acute myocardial infarction, the nurse monitors for which complication of acute myocardial infarction. The right answer is cardiac dysarrhythmia is a common side effect followed by acute myocardial infarction. So 170 members here given the answer correctly. Now move on to question number 71. Question number 71 says a nurse is examining a 8-year-old boy with tachycardia. Which one of the non-invasive tests can determine the extent of hypoxia? Option A, pulse oximetry. B, pulmonary function test. Option C, peak expiratory flow. Option D, chest X-ray. So the investigation which is used to find out the hypoxia, that is non-invasive procedure, is option A, pulse oximetry. It was answered by 87.4% of our participants. That is 271 participants had answered correctly. I don't know one have answered chest X-ray. I don't know what he thought and answered. Question number 72. In question number 72, which measure would be most appropriate for the nurse to do to ensure that child's endotracheal tube is correctly positioned? Option A, mark the tracheal tube at the child's lip. Option B, inspect the water vapor in the tracheal tube. Option C, auscultate the abdominal breath sounds. Option C, watch for yellow display in carbon dioxide monitor. So which of the following action will ensure that child's endotracheal tube is correctly positioned? The right answer is here monitoring the carpanography. Here the color change from pink to yellow color indicates that child's ET tube is correctly positioned. Option D is correct. 76 members have given the right answer correctly. So in carpanography, there will be a color change from pink to yellow color, which indicates that the child's ET tube is correctly positioned. Question number 73. The nurse is caring for a child who is taking corticosteroids for systemic lupus erythematosus. The nurse carefully monitors the child's condition because the nurse is aware that corticosteroids can have the major action occurs. Option A, they increase the liver enzymes. B, they can mask the signs of infection. Option C, they decrease the renal function. Option D, they cause bone marrow suppression. So the corticosteroid drug mainly act by masking the signs of infection? So this answer was given by 117 participants. So the right answer is the corticosteroid drugs tends to mask the signs of infection. Now let's see the question number 74. A nurse has just administered medication via orogastric tube. What is the priority nursing action what is the priority nursing action for nursing action? Option A, flush the tube. Option B, retape the tube. Option C, check the tube placements. Option D, remove the tube. So after administering medication via orogastric tube, the nurse's priority action is to flush the tube so that any medicated particle which is in the side of the tube, the top of the tube, that also will be flushed inside. 171 participants have given the correct answer here. Now move on to question number 75. A 8-year-old, let's see, a 8-year-old girl was diagnosed with closed fracture of the radius at approximately 2 p.m. The fracture was reduced in the emergency room and her arm is placed in cast. At 11 p.m. At 11 p.m. her mother brought back to the emergency room due to unrelenting pain that has not been relieved by the prescribed narcotics. What should the nurse do first? Option A, notify the physician immediately. Option B, apply ice. Option C, elevate the arms. Option C, give additional pain medication as order. So the priority nursing action in this, the client is having the compartment syndrome. So when you suspect for that, the priority action should be to notify the physician. So 209 participants had given the correct answer to the question number 75. Now let's see the question number 76. The nurse has ordered Emla cream. The nurse has ordered Emla cream. How does the nurse assesses that cream? How does the nurse assesses that cream has achieved its purposes? Option A, assess the skin for redness. Option B, note the blanching of the skin. Option C, lightly tape the area where the cream is applied. Option C, gently poke the individual with a needle. This EMLA cream action is determined by lightly tapping over the area where the cream is applied. So for this question, 92 participants had given the right answer. Question number 77. The parent of a 2-day-old girl have been concerned because her feet and hands are slightly blue. How should the nurse respond? Option A, this is a vasomotor response caused by cooling and warming. Option B, this is normal. Her circulation system will take a few days to adjust. Option C, let's watch her carefully to make sure she does not have a circulatory problem. Option C, your daughter have acrocyanosis. This is causing her bluish hands and feet. So here the right answer for a 2-day-old girl, when there is bluish coloration, that is uh, slightly blue, not deep blue, in the feet and hands, that indicates normal finding because the circulatory system needs some time to adapt. So 48 participants had given the answer correctly. Majority of them have gone for suspecting for any kind of circulatory problem like acrocyanosis, but this is not correct. So in a 2-day-old baby, we need to wait for few days. Still, the circulatory system gets adapted and adjusted. Question number 78. The The nurse is caring for a child who is experiencing acute renal transplant rejection. Which of the following most accurately describes the expected side effects associated with first dose of muromonab CD3? Option A, fever, chills, chest tightness. Option B, cough, hyperkalemia. Option C, photosensitivity and GI upset. Option D, urinary retention and decrease appetite. So for a client who is taking muromonab CD3 and who is having signs and symptoms which indicates the rejection of the organ, the symptoms to be noticed by the nurse should be fever with chills and chest tightness. So 154 participants had answered correctly. Now let's see the question number 79. The ethical principle which shows obligation to truth is option A, autonomy, B, veracity, C, beneficence, D, fidelity. So obligation to tell truth, the ethical principle is known as veracity. 181 participants told correctly veracity is the right answer. Question number 80. Acknowledging the performance of an employee is through the way of option A, self-assessment, B, rewards, C, performance appraisal, option D, appreciation. So the acknowledgement to the employee for his performance is done through the method called performance appraisal. 79% of our participants have told performance appraisal is the right. Question number 81. Professional negligence is legally known as option A, slander, B, crime, C, negligence, option D, malpractice. The professional negligence is called as negligence. The right answer is negligence. Option C is right and it was given by 84 members. 94 members have given the right answer here. Question number 82. Babinski sign is considered as normal in option A, newborn, B, adolescents, C, adults, D, elderly. So Babinski reflex is normal in the newborn babies. 279 members have given the right answer. That is 90% of the participants have given the answer correctly. Question number 83. Movement of an extremity away from midline of the body is called A, flexion, B, abduction, C, extension, D, adduction. The right answer is abduction. 75.5% of the participants have given the right answer here. 234 members answered correctly. Abduction is the right answer for question number 83. Question number 84. Tracheostomy is usually performed between the tracheal rings of cartilages of option A, second and third, B, third and fourth, option C, fourth and fifth, option D, all of the above. The tracheostomy is commonly done between the second and third cartilage. So this answer was given by 51.9% of the participants. So 84, the answer is second and third. Question number 85. The study of distribution and determinants of the disease is called option A, community medicine, B, epidemiology, C, entomology, option D, parasitology. The right answer is epidemiology. 91.8% of our aspirants have given the right answer as epidemiology to the question 85. Question number 86. A patient who is threatened and who is comatose is assumed to give what kind of consent for the life sustaining? Option A, informed consent. Option B, implied consent. Option C, direct consent. Option D, express consent. So, in a comatose situation, the patient who is uh, threatened and who wants to give the consent will be for sustaining the life, that will be coming under implied consent. Option B, implied consent is right. 120 members have answered correctly. Many of them have gone for informed consent. So during comatose period, they cannot give any informed consent. Question number 87. Lifestyle modification is an example of option A, primary prevention, B, secondary prevention, C, tertiary prevention, D, primordial prevention. The right answer is option D, primordial prevention. 176 members have given the right answer as primordial prevention. Question number 88. Drugs used to constrict the pupils are called as option A, antimuscarinic drug, option B, mitotic agents, option C, carbonic anhydrase inhibitor, option D, beta adrenergic antagonist. So drugs used to constrict the pupils are called mitotic agents. So 263 members has given the right answer, mitotic agents. Question number 89. Which is the antidote for atropine poisoning? Option A, physostigmine, B, fomepizole, option C, carbonic anhydrase inhibitor, option D, beta adrenoreceptor antagonist. So antidote for atropine poisoning is physostigmine. So 264 members have given the answer correctly. Now let's see the question number 90. Adrenaline dose in an anaphylactic shock is option A, 1 ml, that is 1 is to 1000 ratio IV route. Option B, zero point 0.5 ml, 1 is to 1000 in IV route. Option C, 0.5 ml, 1 is to 1000 ratio, that will be in IM route. Option D, 0.5 milligram, 1 is to 1000 ratio, that is IV route. So majority of them have gone for IV route. So but the answer is 0.5 ml. In IM route we are giving in the ratio of 1 is to 1000. Question number 91. The unpredicted effect of medication in which client overacts or underacts to medication is termed as option A, anticholinergic reaction, B, adrenergic reaction, C, idiosyncratic reaction, option D, muscarinic reaction. So the effect of the medication in which the clients either overact or underact to the medication is called as idiosyncratic reaction. So 54.2% of the participants have given the correct answer here. Now question number 92. This technology helps to ensure that right drug and the right dose are dispensed from the pharmacy. Option A, hologram, B, barcoding, option C, documentation, option C, oral reports. So the right drug and right dose which is dispensed in the pharmacy is done through the system called barcoding. So 143 members have chosen the right answer as barcoding. Many of them have confusion. In documentation also there is more chance to get the error. Barcoding is the best method at present times. Question number 93. Vitamin D synthesis begins in which organ? Option A liver, B spleen, C skin, option D bones. So vitamin D synthesis starts in the liver, sorry, skin. Option C skin is right answer. So 193 members have given the answer correctly. Now let's see the question number 94. Causes of vitamin K deficiency includes all except. Option A prolonged antibiotic therapy. Option B obstructive jaundice. Option C hemophilia. Option C administration of uh, dicomarol. So which of the following is not the cause for vitamin K deficiency? The right answer is hemophilia is not a causative factor for vitamin K deficiency. The rest of the three options are the causes of vitamin K deficiency. Now let's move on to the next question. Braxton kicks are seen in option A eye contractions, B uterine contractions, option C muscle contractions, option D abdominal contractions. So Braxton kicks are seen in the uterine contraction. So 87.1 percentage of the total participants among the 100 participants have given the right answer as uterine contraction is associated with Braxton Hicks. Question number 96. Calculate the sampling interval according to the systematic sampling technique. When your sample size is 200 and your accessible population is 40,000. So in systematic sampling technique, you need to use the formula K is equal to the small n by capital N. So that is, sorry, you need to go for capital N by small n. The capital N is the accessible population, the small n is the sample size. So K is the sample. So that is the number of sample, the interval. Now when you go for 40,000 divided by 200, you will get 200 as the right answer. So majority of the participants, 49 percentage, have chosen correctly. 200 is the right answer for the question number 96. Now 97 question. Which of the functioning which is the functioning of nursing management? Option A planning, B networking, C hierarchy, option D administration. The functioning of nursing management is to plan. The right answer is to plan. So here it was given by 54.8 percentage of the participants. Question number 58. Following are the dimensions of health except option A financial, B social, C mental, D physical. So which is not coming under the dimension of health? Financial aspect is not coming under the dimensions of health, whereas social, mental and physical are included in the health dimension. So 299 participants have given the answer correctly. I think for all the 100 questions, for this question only, majority of the people have given the right answer. Now let's see the question number 99. Basic concepts of nursing informatics. Option A service education administration. Option B data knowledge information. Option C evidence practice technology. Option D computer science and work. So the nursing informatics include option B data knowledge and information. So 85 members have given this answer as a right response. Now let's see the question number 100. A feeding problem among infants is option A hiccups, B choking, C regurgitation, D aspiration. So the feeding problem among infant, the right answer is regurgitation. 136 participants out of 310 have given the answer correctly. So these 100 questions we have discussed. The image based questions, let us discuss now. Now let us see the image based questions in the model test 5.0. First question, question number 14. What you are seeing in this image? Option A, it is a kitchen board. B, food board. C, cardiac board. Option D, ambulation board. This image shows option C, cardiac board, which is used in the CPR procedure. Question number 43. Identify the procedure given below in this image. Option A, capillary blood gas sampling. Option B, heel massage. C, reflex assessment. Option D, acupuncture. So this procedure is known as option A, capillary blood gas sampling. Question number 44. Identify the procedure shown in this image below. Option A, labyrinthectomy. Option B, otologic laser procedure. Option C, tympanocentesis. Option D, cochlear implant air surgery. So this procedure is called as option C, tympanocentesis. Question number 45. Identify the procedure given in this image. Option A, newborn metabolic screening. B, Apgar score scale. C, PKU screening test. Option D, bilirubin blood test. So this type of screening is called option A, newborn metabolic screening. The next question. Identify the procedure given in this image. Option A, skin grafting. B, electrosurgery. C, punch skin biopsy. D, cryotherapy. The right answer is option C, punch skin biopsy. Question number 47. The picture given in the image below depicts the which procedure? Option A, external ventricular drainage. B, hemodialysis. C, subdural tapping. Option D, intraventricular drainage. So this procedure shows the external ventricular drainage. Next question. Identify the instrument given in the image below. Option A, electrophoresis device. B, thin layer chromatography. Option C, X-ray diffractometer. Option D, fast gene LED transilluminator. The right answer is option D, fast gene LED illuminator. Question number 49. Identify the instrument given in the image below. Option A, oropharyngeal tube. B, tracheostomy tube. Option C, Rayleigh tube. Option D, ET tube holder. So this instrument is option D, endotracheal tube holder. Question number 50. Identify the instrument given in the image below. Option A, Shalla needle. B, Clemma needle. Option C, Jamshidi needle. Option D, Islam terrifying needle. So this instrument shows the Jamshidi needle. So in this video we have covered 100 questions. So hope you learned new 100 questions today. Thanks for watching to Satu Career 2.0 online nursing channel. Please subscribe to Satu Career 2.0 online nursing channel and comment about this video. Soon we will have the model test 6.0 and the answer key will be discussed soon. Take care. Bye bye.